Are you a new mom experiencing postpartum depression? Having a hard time coping with the changes after giving birth? Or do you know someone who may be experiencing some symptoms, but you're just not sure if that's what it is? Well, today we're going to talk about it. How to recognize if you have postpartum depression, and more importantly, what you can do to treat or manage it. We'll also talk about some of the symptoms and signs that you can look for. Postpartum depression is very serious. Why, you ask? Well, we know that it affects over 1 million new moms in the U.S. each year. And it also can affect both the mother and the child. Think about it. If the mom is not okay and having a difficult time coping, the child will also have a difficult time coping with the changes that mom is going through. Another thing is that it could affect your work or your social relationships. Sometimes new moms here in the U.S., there's a short amount of time that you have out of work to give birth and to bond with your baby. So that means you will be going back to work probably quicker than you expected. So it could affect your working relationships, affect how you perform your work, things of that nature. Postpartum depression is a mood disorder. And of course, as we all know, it affects women after childbirth. But how is it different from baby blues? Well, baby blues are symptoms that you may have that last about 2 weeks after giving birth, and then they slowly subside. It will go away. Those symptoms will go away. However, to know if you have postpartum depression or a possibility of, those symptoms last a little bit longer than those 2 weeks, and those symptoms can be more severe. For example, if you had a little bit of crying or felt a little bit emotional a couple of weeks after giving birth, that is perfectly normal, totally normal. But if that continues to go on and then it becomes crying that's uncontrollable, for example, then postpartum depression may be a diagnosis that you want to look into. We really don't know why postpartum occurs. There's really no one thing to kind of pinpoint it. However, we know that changes in hormones after childbirth could play a factor, as well as stress. You know, there are a lot of new moms that are first-time moms and unsure of how to navigate new mom life, right? They may have a child that doesn't sleep very well, is not eating very well. And as a new mom, you tend to look at every little thing and start to worry about every little thing. So that stress can really, really build up. And on top of that, you have lack of sleep because the baby is up in the wee hours of the night. So stress does play a part in it. And there may be some moms who experience some type of trauma or some type of abuse, right? Those particular experiences could also play a factor in postpartum depression occurring. And there is some research that genetic factors will play a part as well. So, how do you know if you have postpartum depression? Like, what are the symptoms, right? So some of the symptoms could be sadness, lack of sleep, increased irritability. There could also be changes in your eating habits, changes in your sleeping habits. You may have difficulty sleeping. There may be a lot of guilt that you feel. So kind of going back to returning to work at, quicker than you thought you would, right? Some moms, as far as being off of work, may have about 6 to 8 weeks before they return to work after giving birth. And once you return to work, there's some guilt of maybe leaving the baby with someone or having to place the baby in daycare, things of that nature. So there's a lot of mom guilt. So that could be a symptom as well. And a really, really big one, I really, really want you all to take note of this because it's really huge. If you have or know someone who has difficulty bonding with their baby, for example, they really don't want to hold the baby, they're not interested in feeding the baby, they're not interested in caring for their child. Not that they don't want to, but there's some hesitancy there. That is a really, really telltale sign that they may be experiencing postpartum depression. So please, please make sure that they get professional help or speak to someone to get support if that is happening. And I'll talk a little bit more about treatment as we go on in this video. So we talked about difficulty sleeping. We talked about having a little bit of anxiety as well with those symptoms. Maybe their person is worried about the child. They're worried that the child will fall. Maybe there was some type of traumatic event before the birth of this child. Maybe they lost a child. Maybe they know someone who lost a child. So now that they have a child, they are worried that maybe the same thing will happen to them, right? So all of that plays a factor into some of those symptoms. And if those symptoms are severe, again, if they're not going away, they continue to happen, they continue to compound on each other, then that may be a sign that you have postpartum depression. So now let's talk about treatment, right? There are two different types of treatment that you can kind of categorize treatment options for postpartum depression. So the first one would be some professional options for treatment. And the second category would be things that are sort of a natural treatment for postpartum depression. And I'm going to make another video about the natural options because there are a lot of ways that you can try to subside those symptoms at home. But today we're going to focus on the professional treatment that you can get. So, if your symptoms are severe, then you want to make sure that you do get some type of support, right? Having severe symptoms is an indicator that you really need support and you can't do this on your own, right? So the first place that I advise you to go is your OB. After having a child, we have that 6-week checkup appointment. At your OB appointment, they're going to be asking you. Most OBs now have a questionnaire that you fill out once you come for your follow-up appointment. And it'll ask you things like, do you have support? Are you experiencing any difficulties at home? Are you having uncontrollable crying? Are you feeling like yourself? It's very important to be honest on that questionnaire because that can start the conversation with your OB about what treatment you may need, or if you need treatment for the postpartum depression at all. So that is the first place that I recommend, especially if you have just given birth. But keep in mind that postpartum depression can occur anywhere from a couple of weeks after you give birth all the way up until 1 year postpartum. There are a lot of clients that I have that have reported having, those symptoms when their child turned 8 or 9 months. And they weren't sure, they didn't know that it was postpartum depression, right? They felt okay for a long time, and then all of a sudden they started to get those severe symptoms when they had not experienced that before. So please keep that in mind. Keep track of how you're feeling up until that first year of the baby being born, because it could happen anytime throughout that duration. So the second place to receive professional services after the OB, because your OB, it's less likely that you're going to return to that OB if everything is okay, right? Um, they're just checking to make sure things are going well, and at the 6 week appointment, then after that, you probably won't see them for maybe another year or so, right? But in between that time, because those symptoms could happen up until that year, you can also go to your primary care physician, right? Primary care doctors are really a great go-to because they probably have been treating you for a long period of time. They know your history as far as what medications you've taken before, what kind of symptoms you've had before, any health diagnoses that you may have that are not related to the mental health. And so it's good that you go to the primary care doctor, because they can also have that conversation with you about how you've been feeling, what your symptoms are, so on and so forth. They can prescribe, initially, they can prescribe medication for you. You may be discussing some antidepressants, or they may provide a referral to a psychiatrist. And a psychiatrist, a medical doctor who prescribes medication for your mental health. A lot of people get psychiatrists confused with psychologists or therapists. Therapists and psychologists do not prescribe medication. Only medical doctors will prescribe medication. Now, some people do get a little nervous about maybe talking to a psychiatrist, and really it's just look at it as a consultation. And I will get into that in another video as well. Differences in those professions, and how you can use those professions to your advantage to really, really get better. So we talked about your OB, your PCP, and the third one is, of course, a therapy, right? You want to make sure that you have support in speaking to someone on a weekly basis, or sometimes even more than that, right? Going to therapy will help you learn new coping strategies. Having a child for the first time, or even a second, third time, right? So on and so forth. There's always a new way to learn how to cope with the changes that are happening. So therapy will help you learn new effective coping strategies, as well as help you new ways of effectively communicating what your needs are and wants are now that these changes are happening in your life. And so the best option for treatment are the medication coupled with therapy, because you're kind of tackling those two issues, as far as the hormones kind of being dysregulated, as well as trying to learn new coping mechanisms. You're kind of tackling those things together, and it will be the best option to get you to a better place quicker than just doing one or the other. Now, some people like to start off with therapy first, totally fine. Some people, are not really fond of taking medication, or there may be some moms that may be breastfeeding and they really don't want to engage in taking prescribed medications. Although there are some medications out there for breastfeeding, specifically if the mom is breastfeeding and they're okay, have been cleared to take. But definitely make sure you discuss that with your doctor to see what would be best for you. But therapy definitely is something that would need to continue even after you've tried maybe a trial of medication, because again, it is one of the best ways to learn new coping skills and effective communication during this challenging time. Also, a lot of people forget too that you can actually speak with your child's pediatrician. Um, some pediatricians, they will ask the mom during several of those first time visits with the newborn, how they are feeling, how they're coping with things, things of that nature. So please utilize that as a resource too. They're able to give you additional resources, being that you're the parent for that child. And again, other treatment options are kind of in that natural category. So I'll touch on that in another video. And so I hope that you all found value in this video. It's very important to discuss the mental health regarding moms and making sure that they receive the proper education and how to get help and how to recognize what is really happening. And so in this video, we talked about what postpartum depression is, why it happens, how you can treat it or manage it, and the symptoms that you're able to recognize. I hope that you found value in this video. If you did, smash the like button, and I will see you in the next one. Thank you for watching. Until next time.